A few weeks ago, a man named Charles sat across from me in my clinic. He was 72, quiet, neatly dressed, and had the look of someone who used to stand a little taller than he does now. When I asked him what brought him in, he hesitated. "I don't know," he said, eyes drifting away. "I just don't feel like myself anymore." I see this often, men who don't know where to begin because the problem isn't just physical, it's in the silence, in what they've stopped talking about, what they've stopped doing. For Charles, it wasn't just the lack of energy or the poor sleep. It was that he hadn't touched himself not even once in over 8 years. Did you know that stopping sexual activity entirely after 60 doesn't preserve your energy? It drains it. Your hormones, blood vessels, and nervous system all rely on one clear signal. He's still here and he still wants to feel alive. Without that, the body begins to shut parts down. I'm Dr. Mark, a board-certified urologist with over 30 years of experience helping men like Charles reconnect with their health, not just to avoid disease, but to reclaim vitality. So before we continue, take a moment. If you haven't already, subscribe and turn on the bell. That way, you'll never miss the science-based insights I make for men in your stage of life. And if this message speaks to you, type 1 in the comments. If it doesn't, type 2 so I can better understand who's out there. Now, let's begin. Because the first secret you were never told may be the very thing that's been draining you quietly for years. The hidden cost of mechanical habits. When I first started practicing urology, I never imagined how many of my most impactful conversations would start the same way. A man in his 60s or 70s, sitting in front of me, voice low, eyes downcast, saying something like, "It just doesn't feel the same anymore." Some would talk about their inability to climax. Others about needing more intense stimulation to get aroused. But what united nearly all of them was a quiet confusion. Why is this happening to me? Let me be direct. Most men over 60 are doing something that seems harmless, but is silently eroding their sensitivity, their confidence, and even their erections. Mindless masturbation. I don't mean the act itself, I mean the way it's done. Mechanical, rushed, disconnected. It's often squeezed in like an errand done in the same position with the same grip to the same kind of visual stimulus. No emotion, no breath, just routine. And the nervous system it notices. Here's something important to understand. Your brain is constantly learning what to expect from your body. When you masturbate the same way every time, fast tense overstimulated, it wires that pattern in. It teaches your body that this is what arousal means. And over time, it becomes harder to respond to anything else, especially a real person. I had a patient named Lee 67 who once told me, "Doc, I can finish, but only if I use that one specific motion. Otherwise, nothing happens." That's not aging, that's conditioning. This pattern is called a neurological loop, and it works like this. The more you repeat the exact same motion with the same stimulus, the more your brain expects only that. You stop responding to softer touch. Your erection quality declines. It becomes harder to climax. You need more pressure, more intensity, more time. Eventually, you stop wanting intimacy altogether, not because you've lost desire, but because your system has been trained to ignore everything that isn't the routine. Now imagine doing that for 10, 20, even 40 years. The result, a man who can no longer feel pleasure from real connection. And it's not his fault. No one ever told him this could happen. There's even a clinical name for this now: porn-induced erectile dysfunction, PIED, and delayed ejaculation. And while it may sound like something affecting only the younger generation, I'm here to tell you it's affecting more men over 60 than you think. They just aren't talking about it. What's worse, the emotional spiral that follows. You start avoiding sex because it feels awkward. You feel embarrassed when things don't go as expected. You stop reaching out to your partner. Or if you're single, you convince yourself there's no point in trying again. That loss of confidence isn't just psychological. It shows up in posture, in energy, in the way you see yourself in the mirror. The body begins to close in, slowly, quietly, until it feels like you've disappeared from your own skin. But here's the truth. No one tells you your body isn't broken. It's overtrained in the wrong direction. And the good news is, just like it was trained into dysfunction, it can be retrained out of it. You just need a new approach, one based on presence, not pressure. That's why I tell my patients to begin again, slowly, mindfully, with breath, with awareness. Reconnect to sensation. Treat touch not as a task, but as a form of nourishment. and your body will begin to relearn what it forgot. But before we get into how to do that, there's a twist you probably didn't expect. Because while mindless masturbation creates damage, abstinence can be even more dangerous. In the next part, we'll talk about a common belief that's silently harming men over 60 and how not ejaculating at all might be doing far more damage than you ever realized. When abstinence backfires, there's a moment I'll never forget. A man named Richard, 69 years old, came to see me about his frequent nighttime urination. He said, "Doc, I'm up 5, sometimes 6 times a night. It's like my bladder's got a personal vendetta." I ran the usual tests, ruled out infections, checked his prostate size. Nothing jumped out. So, I asked a question that always surprises my patients. "When was the last time you ejaculated?" He laughed uncomfortably and said, "Maybe 8 years ago my wife passed and, well, I figured that part of life was behind me." That assumption that older men should just retire from sex and touch altogether is not only outdated, it's dangerous. Because what most men don't realize is this: when you stop ejaculating completely, your body doesn't pause, it clogs. Let me explain. Your prostate is a gland, and like any gland, it produces fluid, seminal fluid to be specific. This fluid isn't produced only when you're aroused, it's produced regularly, and when it doesn't get released, it builds up, slowly, silently, creating congestion. Think of it like a faucet dripping into a stopped-up sink. At first, nothing seems wrong, but over time, the pressure builds, and that pressure can lead to inflammation, discomfort, and even damage. In Richard's case, the pelvic pressure he was feeling, that wasn't just aging. It was a swollen, congested prostate one that hadn't had any relief in years. He wasn't broken, he was backed up. There's even medical research supporting this. In one long-term study involving over 30,000 men, researchers found that those who ejaculated at least 21 times per month had a significantly lower risk of developing prostate cancer than those who didn't. That's not superstition, that's data. But beyond the statistics, I've seen this transformation with my own eyes. Once Richard understood what was happening in his body, he gave himself permission to start touching again, not from loneliness or lust, but from care. Within weeks, his symptoms began to ease. The pressure subsided. He was sleeping better. He smiled more. And he even said, "I feel like something inside me just woke up." Here's the thing. Ejaculation isn't just about pleasure. It's about clearing the system, releasing tension, maintaining fluid dynamics in your reproductive tract. Think of it as internal maintenance, not indulgence. And yet so many older men carry the belief that masturbation is childish, embarrassing, or even dangerous, that it's something they should have outgrown. But those beliefs are killing your health, literally. Because stagnant fluid doesn't just affect your prostate, it also increases your risk of infection, contributes to urinary symptoms, and creates a chronic inflammatory environment, one that wears you down from the inside out. You wouldn't ignore your lungs and stop breathing. You wouldn't ignore your digestive system and stop eating. So why ignore your reproductive system? And look, I get it. For many of you, the shame runs deep. You were taught that sex is only for reproduction, that touching yourself is dirty, that pleasure is a sin. But I want to say this clearly: your biology doesn't care about cultural baggage. It needs what it needs. When you deprive your system of that natural release, you're not being virtuous. You're being misinformed. But don't worry, it's not too late. Just like Richard, you can begin again. And when you do, you might find not only physical relief, but a renewed connection to a part of yourself you thought was long gone. Still, if that kind of shame and silence has been weighing you down for decades, it won't disappear overnight. And in the next part, we're going to talk about exactly that, how emotional repression around self-touch doesn't just mess with your mood, but directly damages your brain, your nervous system, and your quality of life. Shame is the invisible toxin. He sat on the edge of the exam table fidgeting with the cuff of his shirt. I'd asked a simple question: do you ever engage in any kind of self-pleasure? And he froze. This man, Michael, 74 years old, retired accountant, sharp mind, warm smile, suddenly looked like a boy caught doing something wrong. Not for years, he mumbled. It just doesn't feel right at my age. That sentence, "it doesn't feel right," has haunted more of my sessions than I can count. Not because it's unusual, but because it's tragically common. And the root of it, shame. Not the kind that yells at you, the kind that whispers, the kind that lives in your bones, that tells you you're too old, that it's inappropriate, that pleasure is something you should have left behind decades ago. But here's what you need to know. Shame isn't just a feeling, it's a biological toxin. It lives in your nervous system, and over time it rewires the way your body relates to itself. I want you to imagine something. Imagine you were never told that masturbation was shameful. Imagine you were taught from a young age that touching yourself was part of health, of emotional regulation, of vitality. Do you think you'd be carrying this tension in your shoulders? This hesitation in your voice? This guilt in your gut? Of course not. But most men grew up hearing it was dirty, weak, wrong. And even if no one says those words anymore, they echo inside you. And when you internalize shame, your body adapts. It tenses, it closes, it protects. I've seen this countless times. Men in their 60s, 70s, even 80s, walking around like ghosts, alive but not fully present in their own skin. Not because they don't care about health, but because they've been cut off from the most primal connection to themselves: touch. When you stop engaging with your own body, you lose access to the chemicals that regulate stress and mood: dopamine, oxytocin, serotonin. These aren't just pleasure hormones. They're essential for emotional stability, sleep, and even memory. One man I worked with, Alan, 71, hadn't masturbated in over 15 years. He wasn't religious. He wasn't ill. He was simply ashamed. He said, "I don't want to be that guy." But what he didn't realize was that by denying his body's basic need for self-connection, he was becoming someone else entirely. Tired, withdrawn, irritable, and disconnected. We didn't start with sex. We started with breath, with hands on his chest, with the simple act of lying still and feeling his body again. And slowly things shifted. He began to sleep through the night. He started smiling more. His digestion improved. Even his blood pressure dropped. Shame had kept him numb for years, but once he broke the silence, once he gave himself permission to feel again, his entire system woke up. That's the thing. Shame doesn't just hide you from others. It hides you from yourself. And let me say this clearly, you are not too old to feel good in your own skin. You are not too far gone to reconnect. You are not broken. You've just been unpracticed. When I see a man finally let go of the shame he's been carrying since childhood, it's like watching someone return from exile. He stands differently, breathes deeper, thinks more clearly, feels more alive. And if that's what shame can do to a man, imagine what happens when you layer in something even more powerful: your hormones. Because the next truth I'm going to share is one most men have never been told. Your testosterone isn't just dropping because you're aging. It's dropping because you've stopped giving your body a reason to produce it. Touch fuels testosterone. Let me ask you something most doctors won't. When was the last time you felt truly alive? Not just awake. Not just going through the motions. I mean that deep, grounded, electric feeling in your chest that says, "I'm still here. I still matter. I still want to feel." Because here's the truth, if it's been a while, it may not be your age, it might be your hormones, and more specifically, your testosterone. But what most men don't know is this testosterone doesn't just fall because of age. It drops when your body thinks you don't need it anymore. Let me explain. I once had a patient, Gary, 73, former high school football coach, built like a brick wall, or at least he used to be. When he came in, his shoulders were rounded, his gait, slower voice, soft. "I just don't feel like myself anymore," he said. No drive, no energy, no spark. We ran his labs. Sure enough, low testosterone. But here's where it gets interesting. Gary wasn't sick. He wasn't on medication. He'd simply stopped living like a man who needed testosterone. He wasn't lifting weights. He wasn't challenging himself. And most importantly, he hadn't touched himself sexually in over a year. He told me, "I just figured it didn't matter anymore." That belief alone is enough to start shutting down systems. Testosterone is a demand-driven hormone. Your body produces it in response to signals, movement, excitement, desire, even erotic thought. And when those signals go silent, production slows, muscles shrink, belly fat increases, energy tanks, sleep fragments, confidence drops. Not because you're old, but because your body assumes you've stopped needing the fuel. But the moment Gary began reconnecting with himself, first through breath, then through intentional touch, then light movement, something shifted. His numbers rose, but more importantly, so did his presence. His eyes brightened, his laugh came back, his handshake was firm again. Here's what I tell every man: self-pleasure isn't just about release. It's a signal, a physiological memo that says, "Hey, I'm still using this system. Don't shut it down." Multiple studies have shown that even the anticipation of sexual activity can raise testosterone. It's not just the act, it's the intention, the imagination, the engagement. And before you think this only applies to younger guys, think again. Older men still have the machinery. What they often lose is the permission to use it. So let me give you that permission. You are allowed to desire. You are allowed to touch. You are allowed to feel good in your own skin, and when you do, your biology listens. It adapts. It begins to rise again, literally and hormonally. You don't need a prescription to start this process. You need presence, breath, attention, and a willingness to step back into yourself. And no, this isn't about becoming who you were at 25. It's about reclaiming who you still are at 65, 70, or 75. But testosterone isn't the only system that suffers from disconnection. Your erections, the symbol of function, vitality, and vascular health, are next in line to disappear if left unused. And in the next section, we're going to talk about the quiet truth most men never hear until it's too late. Use it or lose it. I had a patient named Walter, 68, soft-spoken, a retired dentist. He walked into my office without urgency, just routine follow-up blood work. But as we wrapped up, he paused by the door, turned back and said, "Doc, I haven't had an erection in nearly 6 years. I don't really need one anymore, right?" He said it like he was asking permission to stop caring, like he needed me to confirm what he'd started to believe, that his days of intimacy, of arousal, of feeling like a man were supposed to be over. I asked one question, "Do you want to care?" He didn't answer right away, just stood there blinking. Then he said quietly, "I'm not sure I remember how." That's the danger right there, not the loss of function, but the loss of memory, of identity, of the impulse to want more from your own body. Let me be clear, erections aren't just about sex. They're about health. They're about blood flow, vascular elasticity, neurological responsiveness. They are one of the clearest indicators of cardiovascular and nervous system integrity a man has. And, like any system, they require use. If you go years without triggering that response, your body doesn't wait patiently for you to come back. It starts to shut it down, slowly, quietly. The smooth muscle tissue inside your penis begins to atrophy. The tiny blood vessels lose flexibility. Scar tissue builds. Nerve pathways start to disconnect. Nitric oxide production, essential for getting and keeping an erection, decreases. What starts as disuse becomes dysfunction, and what begins as "I don't really need this anymore" often becomes "I couldn't have it if I tried." I've seen this more times than I can count. But here's the good news. Most men never hear erectile function can be revived, even after years of dormancy. Walter and I built a plan. Not pills, not devices, just presence. A 10-minute routine daily with no pressure to perform. Just breath, gentle touch, and awareness. At first, nothing changed, but by week 3, he noticed something tingling warmth response. By week 6, spontaneous morning erections returned. Not every day, but enough to wake something deeper than his body. His hope. And do you know what surprised him most? It wasn't the return of function. It was the return of confidence. He stood straighter. He joined a hiking group. He reactivated old friendships. When I asked what changed, he said, "I think I started believing in myself again." That's what no one tells you. Erectile function isn't just physical. It's psychological, emotional, existential. It's not just about being able to have sex. It's about being in your body again, about being fully here. So if you've gone a while without erections, don't panic, but don't wait either. Start re-engaging with that system, gently, intentionally, daily. Because when you signal to your body, this still matters, your body responds. Maybe not overnight, but surely and steadily. And if that weren't complicated enough, there's one factor that can hijack this entire process without you even realizing it. A modern habit so common, it's considered harmless, but it's quietly rewiring the arousal pathways of millions of men. That factor, pornography. And in the next section, I'll explain how something you thought was helping you cope might be the very thing robbing you of your ability to feel at all. I remember when Ronald, 65, recently divorced, healthy by all accounts, came in and asked, "Is it weird that I can only get aroused with porn now?" Not with a partner, not even in my own head, just porn. He said it with shame in his voice, but more than that, with confusion. What he didn't know, and what most men don't, is that this isn't weird. It's common. Frighteningly common. Let me be clear, I'm not here to shame anyone for watching porn. I'm here to help you understand what it does to an aging nervous system and why it might be quietly stealing your capacity to feel. See, porn today isn't what it was in the 70s or 80s. It's not static images in a magazine or slow-moving tapes in the VCR. It's endless novelty, instant gratification, high-speed dopamine bursts, scene after scene, performer after performer, angle after angle. What used to be fantasy is now a flood, and your brain, especially at 60, 70, or older, can't handle that kind of overload without consequences. Here's what happens. Every time you watch porn, your brain releases dopamine, the reward chemical. But the more you flood that system, the more it adapts. Over time, your brain becomes desensitized. It starts to require more stimulus to feel the same thing. More novelty, more intensity, more extremes. Meanwhile, your arousal threshold climbs higher and higher until real life just doesn't cut it anymore. This is how you go from being responsive to gentle touch, to needing 10 tabs open and 5 minutes of scrolling just to feel a flicker. It's not about perversion, it's about repetition. Ronald didn't realize this. He thought his sensitivity decline was just part of getting older. He didn't know he was conditioning himself, training his brain and body to only respond to artificial hyperstimulation. And the worst part, he believed he was broken. He wasn't. He was just overstimulated. I gave Ronald a challenge: 30 days, no visual stimulation, no porn, just breath, touch, and presence. The first week was rough. He felt bored, frustrated, even hollow. But by week 3, something changed. He began to notice sensation again. He could feel arousal from imagination alone. By the end of the month, he had his first erection without porn in over 2 years. Your brain is plastic. It can rewire, but it needs a break. This process is called dopamine reset, stepping away from extreme stimulation long enough to let your natural sensitivity return. And for many older men, this is the key to rediscovering true arousal, emotional presence, and physical response. Does it require discipline? Yes. But more than that, it requires trust. Trust that your body isn't broken, it's just been hijacked. And like anything hijacked, it can be taken back. So if you've noticed that nothing feels like it used to, if climax feels more like a task than a release, if you can't get aroused without a screen, this is your signal. Step away, reconnect, breathe, touch, wait. Because underneath the overstimulation, the real you is still there, waiting. But there's one more layer we haven't talked about yet. Because even when the porn is off, even when you start to reconnect, there's still one force that can destroy all the progress you're making: isolation. And in the next part, we'll explore how the loss of human touch, not just sexual but emotional and physical, may be the most dangerous mistake a man over 60 can make. The loneliness no one names. A few winters ago, I visited a retirement community just outside of Seattle. I was there to give a talk on men's health. Nothing flashy, just some honest conversation about aging hormones and vitality. Afterward, a man named Henry 77 came up to me, neatly dressed, soft voice, steady eye contact. But what he said hit me harder than any medical question that day. I haven't been touched in over 2 years, he told me. Not a hug, not a handshake, nothing. He didn't say it with self-pity. He said it with fact, like a man reporting the weather. But I could feel something deeper in his voice: resignation, like he believed that kind of connection was simply no longer part of his life. This is the part of male aging no one talks about. Not the erectile dysfunction, not the hormone decline, touchlessness. And I don't just mean sex. I mean the simple primal human contact that tells your nervous system you exist. You're safe. You're seen. The human body, yes, even at 70, 80, or 90, is wired for touch. Your skin isn't just protective tissue, it's a sensory organ. When you're touched, especially by someone you trust or love, your body releases oxytocin, lowers cortisol balances. Blood pressure improves sleep. It calms the amygdala, the fear center of the brain, and triggers feelings of trust, safety, and connection. Now imagine going years without that. What happens? You begin to shut down, slowly, quietly, not out of trauma, but out of lack. The absence of touch creates a low-grade emotional starvation. Your body doesn't panic, it just downshifts. Less energy, less emotion, less hope. I've seen men in their 60s and 70s stop reaching out. They no longer shake hands. They stop hugging their kids. They avoid mirrors. They skip doctor visits. They stop imagining anything remotely intimate. And they don't call it depression. They call it getting old. But I'm here to tell you that's not aging. That's isolation. And it's lethal. Social isolation in older adults has been linked to a 29% increased risk of heart disease, a 32% increased risk of stroke, higher inflammation, lower immunity, even cognitive decline. And the most tragic part, it often begins with the quiet decision to stop touching yourself, not just sexually but meaningfully. When a man stops reaching for his own body, when he stops checking in, stops breathing deeply, stops sending the message, "I'm still here," his nervous system responds by slowly going offline. So let me be direct, if you've been touchless, you're not weak, you're human, and your body is waiting for permission to reconnect. And if that feels uncomfortable or silly or even painful, that's okay. That's normal. This is a muscle. It's rusty, but it's not dead. Start small. Place a hand over your chest. Feel your own warmth. Breathe. Close your eyes. Say nothing. Just feel. Because the moment you do something inside, you will stir. Maybe faintly, maybe loudly, but it will stir. That's your body remembering it still wants to live. But this isn't just about healing from the past. It's about building a future. And in the next part, I'll walk you through a daily practice I give to my patients. A way to retrain your nervous system, reignite sensation, and rebuild the bridge between you and your body, gently, privately, and powerfully. Reclaiming the inner signal. When men come to me feeling lost, disconnected from their bodies, unsure of where to start, I give them something simple. Not a medication, not a machine. A ritual. I call it the daily reset. 10 minutes a day. No goals, no pressure. Just you and your body meeting again for the first time in years. Let me walk you through it. Find a quiet place. No screens, no distractions. Sit or lie down comfortably. Close your eyes. Place one hand over your chest, the other over your lower abdomen. Breathe in slowly through your nose for a count of 4. Hold for 2. Then exhale gently for 6. That's it. That's the doorway. Because that breath tells your body we're safe. It tells your nervous system it's okay to open. From there, let your hands move. Not with urgency or expectation, but with awareness. Maybe you explore your torso, maybe your thighs, maybe your genitals, or maybe not today. The point isn't climax, it's contact. Your goal isn't arousal, it's attention. And over time, something begins to shift. One of my patients, Gerald, 70 widower, former mechanic, was skeptical when I first gave him this exercise. 10 minutes of doing what he asked. I told him 10 minutes of doing nothing, but doing it with yourself. 2 weeks later, he came back to my office and said, "I don't know what's happening, but I feel lighter, like something let go." That something was decades of numbness. Because here's the secret most older men never hear. Your body hasn't forgotten how to feel. It's just waiting for the signal that it's safe to return. And when you practice that signal daily gently with curiosity, you begin to rebuild what I call the inner circuit, the pathway between sensation and emotion, between your biology and your awareness. That circuit gets broken by trauma, shame, disuse, and overstimulation, but it can be rebuilt, one breath at a time. Here's what men report after just a few weeks of this practice. Deeper sleep, softer, steadier erections, less irritability, renewed interest in connection, emotional and physical, greater confidence in movement and voice, and most importantly, a quiet sense of coming back home to themselves. Now, some men will resist this. They'll say, "I don't have time," or "it feels weird," but let me ask you this. Would you rather spend 10 minutes a day returning to your vitality or 10 years drifting further away from it? This isn't indulgence. This is maintenance. You stretch your back, you brush your teeth, you check your blood pressure. Why not check in with your nervous system? So here's my challenge to you for the next 30 days. Give yourself 10 minutes. No pressure, no porn, no expectations, just breath, touch, and attention. If after 30 days you feel nothing, fine, walk away. But if something awakens in you, something soft, steady, undeniable, then welcome it. Because that's not just arousal, that's aliveness. And in the final section, I'll help you put all of this together so you can walk away, not just informed, but equipped, with clarity, with courage, with a practice that's yours to keep. You're not broken, just unpracticed. If you've made it this far, I want to speak to you man to man, not as a doctor, but as someone who's walked this road alongside thousands of others who felt lost, forgotten, or ashamed of what was changing inside them. What we've talked about isn't just about masturbation. It's not even just about erections or testosterone or prostate health. It's about your connection to your body, to your identity, to your aliveness. And somewhere along the way, most men were taught to let that connection fade. We began by exposing the cost of mechanical rushed self-pleasure, how it trains your body into numbness. We peeled back the myth that stopping entirely is somehow noble, when in reality it creates congestion, inflammation, and disconnection. We unpacked the invisible weight of shame and how it poisons your nervous system, your mood, and your sense of self-worth. Then we explored how testosterone responds not to age but to engagement, that your biology listens to what you give attention to. We revealed how disuse, not just dysfunction, can shut down your body's most vital systems, and how porn, for all its allure, can quietly rewire your brain away from reality and into disconnection. We talked about the most dangerous loss of all touch, not just sexual but human physical comforting touch, and how its absence leads to not only emotional decline but measurable health deterioration. But we didn't stop at naming the losses. We created a way forward, a daily reset. A ritual that isn't about fixing yourself, but reclaiming yourself. One breath, one touch, one small reminder each day that you're still here. And now I want to give you something I call the Golden Protocol, the exact practice I give to my patients who want to reawaken their vitality gently and effectively. The Golden Protocol, a 10-minute daily ritual. Step 1. Set the space. Turn off your devices. Dim the lights. Sit or lie down in a space where you won't be disturbed. Step 2. Ground your breath. Inhale slowly through your nose for a count of 4. Hold for 2. Exhale through your mouth for 6. Do this for at least 2 minutes. Step 3. Reclaim touch. Place one hand over your chest or lower abdomen. Begin exploring your own skin, not to arouse but to notice. Explore the texture, temperature, and sensation. Let your other hand gently join in if you feel ready. Step 4. Focus on awareness, not outcome. There is no goal of climax, only presence. Stay with yourself. If you feel pleasure, allow it. If you feel numb, that's okay. Just stay. Step 5. Close with gratitude. After 10 minutes, place both hands over your heart. Thank your body out loud or in silence for still being with you, still responding, still trying. This ritual is more than physical. It's psychological, emotional, and neurological repair. Because your story isn't over, your desire isn't gone, your power isn't lost. It's just been quiet, waiting. So if this message spoke to you, do something simple. Type the number 1 in the comments. Let me know you're still with me. Let me know you're one of the men who's not ready to disappear. And if it didn't speak to you, type 2 so I know who I'm really here to serve. Because I'm not making these videos for algorithms. I'm making them for you. And maybe today is the day you begin again, not to chase who you used to be, but to become the man you were always meant to be, fully present, fully alive, fully you.